So, good evening again, and thank you so much, Mr. Aaron Saunders, for reaching out and being willing to talk to us about what you do. It's always a pleasure for us to have this kind of discussion and also to relate it to what we are studying. So, thank you so much. I think first I would like you to introduce yourself and tell us what you do.
Yeah, so I'm Aaron Saunders. I've been at Cone for 17 years. Um, I get to do a lot of I get to have a lot of fun because I get to do a little bit of everything. I've been on the project that we're talking about today for 8 years, um, and have been in strategy, and I get to do finance and employee relations and physician contracts and land purchases and strategic partnerships. I get to do a little bit of everything, which is really cool. And I guess I've been in healthcare like half my life now, which is kind of crazy. But have been in this kind of ambulatory outpatient setting for the last 13 years.
Wow. So, what aspects of your training prepared you for this? Or most of the things were just because you were there, you were learning and you moved up?
So, I mean, honestly, there's so much to learn in the classroom, and then there's so much to learn in application of it. I've worked for the same guy, Dino Atkins, for 13 years. And when I started working for him, I was just a manager that had very little responsibility, and he was a director. And now uh, he's a senior vice president with a scope of responsibility of over $500 million. And
Oh,
so I've been able to learn from him and kind of grow in that space. But um, you know, working with people and for people that want you to grow too has been important for me and my success in my career.
awesome. So let's just dive into corn health and everything about corn health. So let's talk about the issue of health disparities. We all know Greensboro, right? And
Yeah,
all the
yeah,
issues that has to do with health. And Cone
yeah.
being the main health organization. So first, what has Cone done in this area and what is Cone doing and what's the vision for the future?
I think the biggest ones, can I share my screen? Is
Oh,
that
yes,
possible?
sorry. Yes, please. Let me do that.
Um, I haven't
And
used Zoom in forever.
okay, so
Let's,
now you can share your screen.
let me see if I can even find it.
It should be somewhere down. It should say share.
Let's see that. Let's see chat, React. There it is.
Okay.
Um, so I'll just come and see if it'll just do my screen.
Yes, it's yes, we can see it now.
I think the biggest one, so obviously there's a lot of work that we need to do in reaching everyone. I think historically we've been so central to the middle of Greensboro and doing work, at Cone, at Wesley, really in the center of Greensboro. And now we're trying to figure out how do we get out into the communities that we serve and putting, services right where the people live, right? And so these are I just got up three of them that we're starting to work on right now. If you're not, are you familiar with this Windsor Chavis NoCo community complex that we're working on the city with?
Tell me more about it.
So hopefully, I'll bring some pictures up. So it's really about it's going to be a community center that has things like health and well-being. It will have access to healthcare. There'll be a library in it. They're in the process of they did the kind of the groundbreaking just recently, but we'll be the kind of health and well-being partner in this space. And this is over on the east side of Greensboro. There's just a few pictures here, but it's actually it'll be one of a kind really once it's done in really in the country, kind of one of its first of integrating kind of all these different services. What they're trying to do is blur the lines between like what's a library versus what's space of meeting people versus exercising. So we'll be the health and well-being partner on this one. And I can send you some links to these if you'd like to learn more about them.
Yes,
But these are just
that'd
some
be
pictures.
awesome.
Um, if you didn't know about Resurgent, we're partnering with A&T on this one.
I think I've
So
heard about that, but I think it's good for the students to also know more about it. But I know about this.
yeah, so
But
our
please
intent
share
so
with
here
us.
you'll see a lot of primary care here, urgent care and things like that. Um, it's just groundbreaking. This is actually my boss right here. This is Dino. Um, but you'll see, I'll send you links to these.
Hmm.
But you'll see some typical medical office, and then there's going to be some A&T things that are also going to be housed in this building, and a partnership, which I think it's really important for us to lean on these our local universities because I think we can do a lot more together than we can by ourselves. So this is one, and then we actually just purchased if you can, Connery in June uh, purchased a bunch of land over at Pyramids Village, over at Cone. It's essentially at Cone and 29, just on the other side of 29 from Cone Boulevard. So we bought 31 acres there, and we'll invest somewhere around $150 million in that space too. So these three projects are pretty substantial. But these are just these are really the big ones, right? But you'll still see some kind of smaller primary cares and urgent cares and the like across kind of the Greensboro, Guilford County area.
So, how are these projects being funded?
Through operations.
Okay. I guess
So
another way of asking, knowing
when I
that,
say that,
mhm. Okay, yes, please go further.
well, when I say that, so what I mean is, being nonprofit, anything that we make as an organization, we reinvest in our people, into our community. So new buildings and things like that are funded by the operations of the organization. So we're not taking out loans and things like that to fund these projects. We are very strong financially and have a AA bond rating and like to fund these projects from our operations.
Would you say that is a benefit of a hospital being non-profit?
Yeah. So we don't have shareholders. So like if you own stock in pick the company, when if it's whatever, say it's Walmart, and
Hmm.
at the end of the day, Walmart makes a certain amount of money, they disperse that amongst their owners, right?
Hmm.
Their stakeholders, and our stakeholders are really the community. So we reinvest that to our people and into the community.
Okay, makes sense. So, what is the big goal with all these projects? What's the main goal?
So I think one of the things that I get to do every day is how do we really connect healthcare and well-being? And so you're going to see us in the well-being space a lot more, so that we're not treating people for something that happened from an acute, they had a heart attack or they had whatever it might be. How do we give them spaces to learn and to exercise, cook and things like that, so that maybe we get out in front of something acute that might happen. That's really what we want to do. So, how do we weave kind of healthcare and well-being into the community so that there's opportunities for people to learn? And honestly, that's generational in nature, right? So then you pass that down um, through your children and the like. So, as an example, like on at my site here, we have a teaching kitchen. So this month, if you know Dr. Taub, do you know Dr. Taub? She's a
Yes, I
cardiologist.
do. Yes, I do.
So Dr. Taub and I, we're good friends, and she'll do cooking with a cardiologist, where we'll have members of the community pay a very small fee, or they can also they're able to apply and get it for free. Come cook, learn how to cook a heart healthy meal, and ask questions to a cardiologist at the same time, as an example. So how do we give people a space where they can learn and it's not cost prohibitive either? Because that's the thing, right? Is how do you make it so that people can do it and not feel like they're not doing something else to be able to do it?
So this is one of the things you are doing at the drawbridge, right?
Yeah.
So what are some of the other things that you are doing at drawbridge?
So, I've
Or
got,
maybe talk to us about drawbridge because I don't think everybody knows about that place. So you can share your screen. You can, yeah.
um, can you see that?
Yes, we can all see it.
I'll skip through some of these things quickly. So I'm a bit on this project for 8 years. This is just a map showing the different med centers that we have. I'm trying to move this so you can see. So we've got Kernersville was built first, High Point, Mebane, Greensboro was built, and then Med Center for Women, and then Asheboro. Um, it was a food line, and when we bought it, we were just going to renovate it. And there was a small group of us that said we could do something so much cooler. So it went from a probably $10 million project to $97 million.
Wow.
And here to show like so one of the things we do in design is we like to walk people through the spaces. So what you're seeing here is built cardboard in the food line. So we said, okay, here's the emergency department. Well, let's take the emergency department through simulation of trauma or broken arm or whatever it may be. So we actually use that space and designed based on, walking through some because it's a lot easier to physically walk through a space and see it than see like the drawings.
Mm,
Um, this is just one of the things that we do in design so that we may not miss, hey, it would be make more sense if this was on this side of the room and this was over here, or I was closer to this. We did that. That took about a month, but just to give you guys context. But if you went in the emergency department, the emergency department build out looks almost just like this. But that's actually a nursing desk with the physicians working back here.
wow.
But you can only imagine, so it cost about $500 a square foot to build this facility. So if you mess up on, you know, 2,000 square feet, that's $1 million. So you don't want to miss in design. Um, that was a food line, but then we bought five more pieces of land. It's about 9.5 acres.
Mm,
And then we have this new way of getting around Greensboro, right, with the bypass. So
yeah.
we you can see how many people can get here in 30 minutes. It's almost 700,000 people. Before the loop was done, it was closer to 500,000. And the furthest reach of any emergency department in the whole network. So Alamance, Cone, Wesley, people drive farther to come here than they go to any other emergency department.
Wow.
Um, that's just demographics. So we chose this space. Sorry. Um, there's a lot of growth out here, and we were not meeting the need. So you can see here it says there's about 16% of our whole market, which is about a sixth, but then about a fourth of it was actually the growth. So there's a lot more growth, and then we weren't serving. So one of the reasons that we built out here.
Mm,
Just from a project standpoint, how do you differentiate between patient and customer experience that fulfills on our brand promise? And then this vision down here is how do you think beyond the familiar? And then, how do we make decisions to support, connecting healthcare and well-being? Here's just kind of a service mix. Um, We've got traditional healthcare services, primary care, OBGYN, cancer center, ortho, heart and vascular. We've got pulmonary as well. We've got behavioral health. And then kind of our more non-traditional, we've got Sagewell, and I'll talk a little bit more about that in a little bit. We've got our teaching kitchen. We've got Play, which is uh, essentially childhood development work that we're doing. And then downstairs, we got an emergency department, imaging department, and lab. And then the only other thing is we have retail pharmacy, which I think you had mentioned that you had been accessing.
mhm.
One of the big reasons, to go to the people, build something closer, new access. And honestly, this site, there's nothing like this in the triad that you're going to find. And then how do we learn from this and those other projects that I showed you? How do we take that to those projects, our learnings from here, to help inform what happens at those other projects? This is how the building's stacked. It's not very interesting. Um, just to give you guys some perspective on how long these projects take. I said I've been on this for 8 years. We bought the land in 2016. We opened in 22. We just finished our third year. But getting approval from the state. And um, we had COVID in April of 2020, so we shut down. We did nothing for 6 weeks, and we bought everything. So if y'all remember in 2020, there was stories about, everything's so much more expensive. And what we did is we bought everything in April, and we bought the parking deck, we bought all the steel we needed, bought all the plumbing we needed, and we saved probably about $10 million just by buying it at that time. Um,
So was it cheaper for you during the COVID time?
no, I mean we hit budget, but it was just because we agreed upon kind of what was the price with our general contractor and the like. But
Okay.
because we bought it out in April, we did not see price escalation in anything.
Oh, okay. Makes sense.
And then we phased it. So this is just kind of the phasing of the campus. We didn't want to open everything at one time. Sagewell was first, and then you can kind of see the progression of
Mhm.
other to open.
Wow.
Only thing I was going to touch base a little bit on Sagewell. So Sagewell is our fitness center. So Sage is from the earth that heals. Sage is also a wise person, and then well-being. So it's Kona Health, and it is medically integrated. People say, well, what does that mean? All of our staff are degreed in exercise science and nutrition and the like, so that you're learning from people that, this is their passion, this is what they went to college for. We have oversight of physicians. We even do a lot of things like we do Parkinson's classes. We
Mm.
do classes for cancer patients and their caretakers for free. We have brain injury support groups. So we're really trying to figure out how do we reach the people who don't have places to go, right, to exercise, or where they don't feel comfortable doing that. And so creating spaces and classes for those that may not have access to any of that anywhere else is important for us. And we continue to evolve what that looks like here on campus, whether that's doing, outreach for community events, or we're doing exercise classes, or we're doing cooking, as an example.
Nice.
Uh, so the so the interesting thing about healthcare is, if you look at this kind of wheel, we historically have diagnosed you to treat you to get you better, right? And then what we want to do is prevent and educate on the back end. The question is, how do you turn this upside down so that you're educating and preventing, so you're not getting to these other things? And how do you do that through health and well-being? And that's really why we want to invest in kind of this health and wellness space, so that we give people the opportunity to learn about how to exercise, and how to cook, how to shop, even on a budget, and things like that.
So, Aaron,
And
let
then,
me ask you this. Um, Access, right? When we
yeah,
so you have all these things going on, they are cool, but I think about how easy is it for people to get to that place? Because it's just there, right?
yeah,
For me, it's close to my kids' school. I always drive by. But what about
yeah.
the average person who may not have a car? How do they reach the place?
So I think this is just the first one, right? In kind of Guilford County. So that's those other sites that I showed you. That's where we're going next. So it's Pyramids Village, it's the Resurgent, it's you know the Chavis Noco, the library. So I think, yes, this is kind of just the first step, and we're not reaching everybody. We know that, and it's just gonna take us some time to get to other places. But that's our intent, is, how do we get this? How do we learn from this space and take it other places? And honestly, they will not all look the same, because all communities' needs are not going to be the same either. And so how do we right size that for, Pyramids Village as an example?
Okay.
But everything, like, there's nothing here that um you we have scholarships for Sagewell, we have scholarships for play, we have scholarships for our teaching kitchen. So plays our early childhood development. We do classes from 10 weeks or so to 12 years. We do things like Ninja Warrior Camp, we do things like gymnastics, things like that. So we want to create a space where kids wanted to go, so that parents could take care of themselves, because what we found in our research is that if parents aren't taking care of themselves, it's because they feel guilty because their kids, don't want to sit and watch an iPad for 2 hours while they work out. So how do we create a space where they want to come?
Mm.
And here's just a few pictures. Um, We've got three pools. So you've got a lap pool, you can see that, and then that little pool with the people in it is a water therapy pool. And so the majority of people that are coming to that either cannot walk or can barely walk. And so being able to give them a space where they can do things in a pool that they cannot do in like a setting like in the fitness center is important for us. And you're not going to find that anywhere else in this area either. Um, we have about 10 people that come out and do water therapy. I have two full-time women right now that actually all they do every day, all day is they're in the pool. And we also do pediatric therapy too. So the majority of the kids doing therapy, kids in our pool live in their wheelchairs. So, they get a sense of independence that they get nowhere else here. And that pool's 95 degrees. The lap pool's 85, and then our whirlpool is about 100, 103.
Oh.
So we're seeing this gives you an idea of kind of how big it is. It is massive. It's 160,000 square feet. And really don't have the ability to build much more. And honestly, we've seen so much, at the end of the day, people come here not because it's a pretty building. We have nice floors. They come because we have great people. And that's so important, for us is, how do we differentiate with our people and our programming? And that's what we will continue to win with is our providers and our people. We know people have choice, and we want to do everything we can to make this their choice for healthcare and well-being. So that's what I had for that. If you want me to unshare my screen.
But yeah, I was going to ask you, in terms of competition, do you have any competition?
Yeah, I
Because you
mean,
want to be relevant,
Atrium's
right?
trying, Atrium's trying to build a hospital a mile away from here. They're going to invest, I think the final number was 400 some $1 million a mile from here. And it's a hospital, right? If we wanted to build a hospital, we could have built one here. And we said that we were going to invest in the health and well-being space. And what I joke when I tell people that this is the new hospital we want to keep you out of the hospital. So this is, the space that we built to try to keep you out. But yeah, Novant, Atrium to our east, it's Duke and UNC. I mean, we're surrounded by some of the best academic medical centers in the entire country.
Would you say health, would you say healthcare is good business? Because if everyone is going in it, then I think hospitals are making lots of money.
And we're honestly it's become so challenging. Health systems have seen huge increases in cost when it comes to things like pharmaceuticals, when it comes to staff. Um, we have a shortage of lots of different staffing play areas like nursing, like physicians, like um, lab technicians, and uh, radiology techs. So, we're having to pay people to come from out of town to work for us just because the supply is not there. And yeah, we continue to see huge increases in things like pharmaceuticals, um, even building things, right? So yeah, I mean, what we hope to get from a percent margin, usually is somewhere between 1% and 3%. Um, and that's that's pinch and penny sometimes, when you
Mm,
think about it. So essentially every $100 we collect, we want to keep like two of it, two, three of it.
well,
And that's the thing that we just don't, when you go to Target and you buy something, when you scan it, it's the same price, right? And
mhm.
that's the complicated thing in healthcare is that, our negotiated rates with Blue Cross or what we get from the government are all different. And so it's very complicated, to say like how much does something cost, where in most world, you just go in and it says how much it is, right? Or they tell you what the price
Yeah.
is. It's a
Mhm.
little more complicated with that. Even if someone has Blue Cross Blue Shield, they could have 20 different plans. And so are they on a high deductible plan? Are they on a narrow network? Or what are they? There's just so many different plans out there.
Well, but still thinking about, all the other um, hospitals or healthcare facilities. You think about Atrium. I thought it didn't go through. I knew there was a lot of back and forth between Atrium and Cone Health, but I didn't know finally Atrium got the right to build.
Yeah, so they'll build. It's not a so what you do is you essentially negotiate terms when it goes to court like that. So they will not open until 29. The hospital will not open, but if you drive by there now on Horseman Creek, they're starting the medical office building and the surgery center right now.
Wow. So, two things. One, what is causing the shortage of healthcare personnel?
I mean, people are just not, we just don't have the people getting into it that they were before. And we're seeing a lot of burnout too. COVID was really hard on people. It was hard on caretakers. It was hard on nurses. I mean, you got to think about it. You know, in March of 2020, we told everybody to go home except all of our frontline workers. And
Mm,
and we said, come, we need you at work. And by the way, you have to wear all of this, personal protective equipment now. You need to wear a mask. We need you to wear, you know, gowns and we need you to work as much as you can because every day 10% of our workforce has COVID, and so people got burnt out on it, and it was hard on people. And so I think that was challenging. We're seeing a lot of physician burnout too, and that's not just local. That's really across the country. So how do you work on that? How do you help give providers work-life balance, right? The workforce and what they value has changed a lot, right? And so now it's not just, you know, I have a great job and I make a lot of money. I need time for my family and I do need time for myself. And so, it's definitely a culture shift in what people put value on, right?
most of students in my class are students in the health management um, field. I have few who are in economics, but most of them are in health management. And so one of the questions, people would ask is, what is thinking about the future, thinking about jobs, right? And thinking about how the market, the whole health industry market is looking. What are the opportunities? What are the things that they can do to make them better, a better fit for the market? Because at the end of the day, they need to get a good job, right?
Yeah.
So, which I don't think is just about the degree, but what are the things that they have to do to make them very competitive?
So one, I would say saying you want to be in the healthcare field is the most, loaded. When you ask what to do, it's such a loaded question, right? Because there's so many avenues you can go, right? I mean, just in the healthcare industry, you can do things like you can be in hospitals or clinics or home health agencies. There's lots of things within those. So you can do HR or marketing or finance or operations, or I mean, there's just so many different things. So, I would encourage folks to, figure out how you might do some shadowing. Maybe you find some internships because sometimes it's not necessarily about what you want to do. Sometimes it's about what you don't want to do too, right? And there's things that I don't want to do, but I know those, right? So I think where there's opportunities to do shadowing or be able to do some internships, maybe even if it's able to work a little bit, um, you know, in your latter years of college. But some of it's just going to be getting in and saying I don't like this or I do like this. I mean, some of it's going to be just them researching. Like I'm a math guy. So I tell them I'm not good at a lot of things, but I'm really good at math. So that's really helped me for operations and finance and strategic planning and and things like that. What are you good at? What do you have a passion for? Because I think that's what we're seeing some of the burnout from too, is that people say, I want to work in healthcare, but they don't know why or they don't know where. And so making sure that you put people in a place where they want to be and they can grow. And then honestly, it's just as important who you work for as what you do. So as you look at these roles, who you work for and how you fit within the team is just as important as the job itself. Like I wouldn't still be doing my job and working for the same guy if I didn't feel supported by him. I didn't feel like he wanted me to grow. I didn't feel like he gave me the space to learn too. Um, that's so important. And I mean, he's like my work brother, but I think he's about 14 months older than me. Um, but the finding those people will be so important to the success of your career. And I still talk to people who have been mentors and coaches. I'm actually meeting with one tomorrow that I've known for 17 years, and I haven't seen her, and she's in town, and she just wants to come and see what's going on and how she can help me. So finding those people, it might be your professors. Um, like I'm on the board at App State in the health science college, and there's professors in that college that are still there that were there when I was there. Uh,
Wow.
so I still connect with them because as big as the world is, healthcare is a lot smaller than you think it is.
Mhm. So let's talk a little bit about data. Let's talk about AI. Let's talk about telehealth. These are it seems to me are basically like new directions that healthcare is going into, or even society, right? Everybody's talking about AI, everybody's talking about data. And then even with health, there's also the issue of telehealth. People are like, I don't, if I can see a doctor while I'm at home, do I really need to go there, right? So how are you seeing that in your scope of work?
Yeah, so telehealth is really hard because believe it or not, the general public feels like they need to be seen by a doctor, right? They need to be looked at, like they need someone to look at their tonsils or, listen to their heartbeat. And that's right, and a lot of times, but what we find is, I hear this from my friends and neighbors and colleagues as well, as they'll call me and say, Aaron, how long is the wait in the emergency department? And I'll ask them what's going on and we'll talk through it. And I say, you don't even have to get out of bed. Do not get out of bed and just do a telehealth visit. I think it's just that we as a society have been so accustomed to being with the doctor that the adoption has not been what we would like. During COVID, you had to do it, right? But then when we got back to bringing people in, they didn't want to do as much telehealth. But I'll tell you, there's nothing more easy than doing a telehealth visit from your bed and then being able to just go to the pharmacy and get it instead of having to wait in an emergency department or, sit in a lobby with a bunch of other sick people. But that's a challenge, and I think that's more just the adoption of it is the adoption just hasn't accelerated, even though we did so much 5 years ago. Now, from a like Sage Roll standpoint, how do we reach people in their homes when it comes to health and well-being? So our app right now that we're developing, you might be able to buy like a digital membership, so you could take classes from your dorm room, or you could take them from the beach, right? Um, and you might be able to might be able to take the one you took last week today because it's archived. Same thing with the cooking classes too. How do we teach cooking classes where people could access them from their own kitchen, or even access them when if they're at work and they can't, then they can watch them later. But that one's hard. I mean, we're in this era where everyone wants to do everything on their cell phones, but ironically enough, when they want to see a doctor, they want to like physically see a doctor. And then from an AI, we're still trying to figure that out. I mean, healthcare is uh, it's so human in nature, right? So we have to be really careful that we don't want to dehumanize the work that we're doing. There's just so much about, being able to connect with your provider and your nurses, that we want to be mindful of how do we use AI so that people can do more of the things that they should be doing, like patient interactions and caring for patients instead of doing so much documentation, right? maybe I spend less time in front of the computer, and I'm able to spend more time with patients, right? But we're still trying to understand that one. When we think about data, I have dashboards that I can look at today that were updated yesterday with yesterday's information. I know how many people came in yesterday. I know what they were seen for. I know what they were referred out for. Did they get a CT after that? Did they go to the pharmacy? What did they do? What are the services they're accessing? So I've got stuff now. We're looking at things real time, and we know where patients, are coming from, how far they're driving, things like that. But I even know, if a patient, how many services does an average patient in the buildings use in a year? And the answer is over four.
Mm,
Um, because we're tracking that because we want to understand what's important for patients to have services together versus not, right?
yeah.
So if you go, like I'll use the example, if you're a patient going to see the OBGYN, you can come here, you can go to your OBGYN, you can take your kid to play to get babysat for 2 hours for like $10. You can get your mammogram, you can get your labs, your bone density, and you can get your prescription all here in, a matter of an hour or two, whereas, typically you would have to go to what, five different physical places, and you might have to get a babysitter or take off of work. So how do we create kind of a convenience factor to where you can do multiple things? And by the way, those people are working together on your care too, so it's more coordinated, and you're able to get better outcomes because people are working together, which we don't see happen enough in healthcare too.
Mm. So let's shift a little bit. Let's talk about cone health and acquisition. Why the acquisition? Um, how beneficial is that? How is that going to make cone health better off? What do you think we should all expect? Not that it really matters to us, but from an economic um perspective, why would a bigger organization purchase or acquire this one? Like, explain the whole process to us.
So, so this is not one where it's any and everyone can apply, if that makes sense. So this company is very selective in having, well run, in high regards from a quality, from a financial standpoint, and like-minded organizations and how they can work together. So Geisinger is part of it. They're in Pennsylvania, but Kaiser, the parent company, and we were mentioning earlier, they are a $110 billion company. They're the biggest, one of the biggest health systems in the entire country. So being able to understand, what they're learning and what systems they're on and, what their experiences are is going to be really important for us. Obviously, when you're buying things with a company that large, you're able to get the much better pricing, as
Economies of scale. Mm-hmm.
so you gain economies. And then also, what are you able to learn from like their IT department? Their IT department is probably bigger than our health system is in employees. I don't know how big it is, but it's huge, right? And so, what functionality do they have that we don't? What things are they learning around quality of care, and things of that nature? So I think if anything, it gives us opportunity to move faster, to learn faster, and then also, how are we able to save dollars in one area to be able to ship those to others. And honestly, as I told you, we closed the first week of December, so we still don't really know. But you'll see probably they're saying 4 to 5 more health systems join over the next couple of years, and but like-minded, like-sized, really trying to focus on this value-based care versus a volume-based, and we're still trying to figure that out.
Yeah, but so as an economist, when I think about that too, there's a scary part, right? Whereby it's like it becomes like a monopoly, kind of, right? You have this one big healthcare organization basically in charge of everything, giving you fewer options. Which personally, when Atrium came into it, like I had my student do a project on that. I'm like, think about it from an economics point of view, because I feel when there's competition, it drives prices down, it gives us the best quality. But if
Sure.
there's limited competition, then it's like we have no choice. So that's my thinking. But at the same time, too, if we know that the company, is it Rice Sands? Is that the name?
Yeah, yeah. So, and
Yeah.
the thing that I would say is that it really doesn't change competition because, Rising nor Kaiser are even in North Carolina. Um, so re it's still going to be Cone and Nova and Atrium.
It's true.
Our name's not changing. We still are, our board is local. Um, our leadership is still local. So you won't see, from a competition standpoint, the Atriums and the Novants of the world are a lot larger than we are. When you think about just from a sheer number standpoint. And so this may give us an opportunity to help to combat some of that. Because if you notice, we're not trying to build a hospital in Winston-Salem, but they're trying to build one a mile up the road from me. So
But I think just like you said earlier on, maybe we apart Greensboro is growing. We have more people living in Greensboro. It's growing. And also maybe more people are also not taking good care of themselves. So you have more sick people in a way, right? So looking at I like the aspect where you are looking at the prevention part, where we don't want them sick. What can we do to make sure that they are healthy so we don't see them when they are sick, which I think is good. And you mentioned Dr. Taub, and it's interesting you said that because I had her do a workshop at my church, and it was really good. It was good
yeah,
because one, everyone felt very comfortable. Two, they
yeah,
could talk about the local meals, and she understood what they were saying. Versus I going to a nutritionist and I say fufu, and they are looking at me like, "What are you talking about?" And then they tell you eat a cup of fufu. I'm like, do you know what fufu is? And how do I measure a cup of fufu? So it was really
yeah,
cool having her and for her to really, share her experience. And people ask all sorts of questions over the counter drugs, which is very important because I realize people are more comfortable when they feel like the health professional understands them, looks is culturally sensitive, and also looks like them. So
yeah.
in that aspect, when I know right now there's a lot of things going on about, diversity and everything, but really, I think it also matters for a lot of people. When they go to a doctor, I care about how the doctor looks like. I want to be sure the doctor really cares about me and would listen. And
Yeah.
so, what are some of the things you are doing to promote diversity, even at Drawbridge or even Cone Health in general, to make sure that when people come, they are comfortable there?
Well, I'm thinking a lot of that's in the hiring piece. I'll be honest with you. For me, when we're hiring people, it's about the intangibles. You talk about like Dr. Todd, like you can just look at her demeanor and her nonverbals and know that like she's gonna listen to you, right? And she
Mhm.
cares, right? And so, those are things that are the things I can't teach you to do. And so when we're hiring, that's so important for us that people have the intangibles, right? Um, you know, that they listen, right? That they're respectful, right? I mean, these are like the golden rules, right, in life. But what we find is that everybody doesn't necessarily follow them. But that for us is so important from a culture fit standpoint is, you know, are you willing to pick up trash that you walk by? Are you willing to help a patient that is lost or a patient that has a bill question or to get them to the right place? What we try to instill in people is that's not my job is not if that's what you say here, then we don't want you to work here. Um, but yeah, I think we want to continue to strive to have our workforce, mirror kind of what our community looks like too. And some of that's creating things like, training programs and partnering with universities. So we're getting, you know, people that want to stay here in the community too. I think that's important for us too to partner, with the universities with, some of the stuff that we're doing from an education standpoint is just giving people an opportunity who want to do more and get those trainings within our health system, right? So if that's like a CMA academy, we've got people who aren't CMAs that are able, can't read it. There's a chat, there's a question there.
Yeah, I can read it for you. It says, I work at Corn and we were told if you don't have the answer, to direct them to someone something. Let me go. Someone who does have the answer instead of saying that's not my job.
Yeah. Yeah, it's
That's
important, right?
good.
And because at the end of the day, we're all a reflection of each other. And so we have to hold each other accountable because whether if I'm not doing it, then I'm making everybody else look bad. And if no one's holding me accountable, then we're saying that it's okay. Um, so yeah, I think we're continuing to learn in that space, but we've got a really good uh, chief human resource officer now, Michelle, and I think she's doing a lot of really good things around that. But um, it it's never gonna when we say we're there, we don't ever let us say we're there because we'll never be there. It's just we just have to continue to evolve, not only with the community but with our workforce too. And that's hard. The retention piece is really hard because of so much competition, which is
hmm I was
somewhat
going to
challenging.
ask.
It's just challenging for us because there's just the loyalty factor just doesn't exist like it did, 10 and 15 years ago.
It's interesting you said that because there's a the research had the other way whereby they said that right now hiring a lot of young people, a lot of young graduates get fired easily because they just can't stay on the job. They can't focus, and so they are not staying. And that's also because of what happens while they're in college. Like my class is only 50 minutes, but to get a student to stay 50 minutes without being on TikTok or Instagram is hard. How do you go to the workforce and you can't stay, that time off, right? You see people pushing like they are working, pushing trash, and yet they're on their phone. I'm like, can you just focus on what you have to do? Like stay off it 50 minutes and be good.
Yeah,
But it's a big challenge.
it is. It's hard. I mean, I have employees that I've willing to come to work and wear their AirPods, and they're in customer service, face to face with customers, and they want to wear their AirPods all day. And that's great if they want to do that, but they can't work here because whether they can be paying as much attention as they want, but the consumer or the patient is definitely saying this person is not listening to me.
Exactly.
Um, Even if their headphones are off, it's the perception, right? And so um, I think we have to hold the line on what's acceptable and what's not. And those that hold the line will continue to have a high level of experience with their members or patients.
Wow. So, is there anyone who has a question? Anyone, you can just unmute and talk or raise your hand. Okay. Two questions. One is, what would you tell your young self, supposing you were in college, based on what you've experienced? What are some of the things that you would do differently if you had to go back, like looking at yourself 17, 20 years ago?
Uh, that I would tell myself first, it's not easy. Um, you know, I initially had a marketing degree and realized that really meant that I was going to be in sales. And so I quit my first two jobs in 2 days and I went back to school and said, how can I do something where I feel like I'm impacting people's lives? My dad is a pediatric nurse practitioner and has managed pediatric intensive care units and neonatal intensive care units his whole career. And so I wanted to do something where I felt like I was impacting the community around me, and that's why I went back and have work in healthcare now. But yeah, it's not easy, and I think what I'd also tell you is no one's going to give it to you or do it for you. You're gonna want to do more than you're asked to do, and that's where you're going to see opportunities for you to do more. And sometimes you just have to ask for it. That's what I'd say. it's not just, I thought I was going to be doing business deals, traveling and playing golf and doing all the cool things. And what I realize is that it's a grind. But now that I look back, the grind is what makes you appreciate where you get to, and having good people around you to help support you in that.
Wow. That's good. That's good. Well, I think those are the main questions we had, basically, and you've answered all. And once more, the goal of this class is to connect the students to people who are doing the real work. Because we read the books, we have the theory, but I want them to have the practical experience to get the opportunity to talk to people. We had Jamila last week, well, last
Yeah.
month. Yeah, she did a
Yeah.
presentation last month. And so it's always a pleasure talking to you just to know what goes on. And it's interesting because as much as we have students in the community in Greensboro, they don't know a lot of things going on. So it's always nice when we have guests who come and tell us what is going on and also provide opportunities. So, supposing a student needs an internship, do you have any opportunities there now or even
So we
later?
do, so we have like a formal internship program that people can apply for. I think it's usually in the fall because it's like a year. Um,
Okay.
and it's paid. But if you'll reach out to me this summer, I can send that to you and you can hand it or give it to your students to apply. But if there's anything I can do to help, just let me or help you. If you're here next time you're out here, if you want to come by and say, hey, just let me know. Or if you want to get students out here, spend a day with me or whatever. I'm happy to help however I can.
Yes, I would definitely do that.